We all have one thing in mind, which is whether we have good oral hygiene or not. One of the things is bad breath. We always wonder if our breath stinks, if when we talk, if we say something and we're just kind of smelling our breath, just to make sure that we don't stink. Another thing is food in the teeth. We're always checking, making sure that we don't have anything in between, or if we feel something, we're always thinking about that. Another one is a toothache. We're always checking to see if one of our teeth are hurting, always self-conscious to see if one of our teeth look right. Another one is just a general dentist appointment. We're always thinking about whether we need to get our teeth cleaned or if we need to get a cavity filled, things like that. So why is it important to have good oral hygiene? So what happens if you don't brush or floss your teeth? Well, one of the things is plaque buildup. It's a sticky material that contains a bunch of bad bacteria that actually sticks onto your teeth, and it causes cavities, which in those cavities eat away at your teeth, eat away at the enamel, the dentin, and then eventually can go to your roots and even the bone in your jaws. So it's always good to brush your teeth so that you don't have that. But if you don't, then that plaque builds up and you could actually lose your teeth. You are at higher risk for heart attack, stroke, preterm labor, and even diabetes by not brushing your teeth from this bacteria that grows in your mouth. One of the big ones that people think about is bad breath. We're always another thing is bad breath, which if you don't brush your teeth, you don't floss, you don't use mouthwash, it could actually cause halitosis, which is a chronic bad breath where you need to go to the dentist, actually get a prescription, and that way it will kind of kill the bacteria that's in your mouth and get rid of that bad breath. So now that I told you a little bit about what happens if you don't floss or brush your teeth, I'm going to tell you about the stages of tooth decay. So the very first one is white spots, and it is the beginning of a cavity. They're little tiny white spots that start on your teeth. Usually they're in the molars, so you can't really tell them, and you usually don't really know what you're looking for unless you are a dentist or you have practiced dentistry and you know exactly what the white spots look like. The second stage is enamel decay. Enamel decay is when the cavities start eating away at the protective layer of your tooth. And from there, it actually goes from the inside out. And usually this is when you go to the dentist and they say, hey, you have a cavity, you need to get it filled. And so that's the only way to protect against and correct the stage 2 of tooth decay. The third stage is dentin decay, which is, dentin is mostly what your tooth is made of. You'll have a slight toothache if it does reach this point, and again, the only way to correct it is through a filling, but usually it is a larger filling versus the enamel decay, where it's usually just a tiny filling of where the white spot had begun. The fourth stage of tooth decay is involvement with the pulp of your tooth, which is where all the nutrients, all of the roots are located at the very bottom, right next to your bone structure of your jaw. Usually there's a lot of pain, and it actually requires a root canal to protect the teeth. And so usually causes a lot of pain and requires a root canal, which then you either have to get a cap or a crown to cover it. The fifth stage of tooth decay is actually abscess formation. And this is when a cavity reaches the roots in your teeth and it infects the tissue and the bones surrounding where the cavity started off and where it reached inside of the tooth. It needs treatment immediately, and if you don't get treatment immediately because of the bacteria, it actually could cause death. So now let's talk about some of the good things about proper oral hygiene. It actually, by cleaning your mouth, by brushing, flossing, doing mouthwash, you actually will get clean saliva, which there is no such thing as clean saliva, but with saliva, you can actually swab the inside of your cheek, and you can actually find out whether you have like a certain type of infection, whether you have a certain type of cold, and essentially it is just a tool for the body to kind of recognize where. Stop real quick. Okay, so some of the good things about having proper oral hygiene is actually having clean saliva, which clean saliva, there is no such thing as clean, but you can actually use it as a diagnostic tool for your body. So if you're sick or you have an infection, you can actually swab the inside of your cheeks, and it will allow you to determine whether you have a certain sickness, a certain illness, things like that. Another reason to have proper oral hygiene is clean and debris-free teeth. So no food in your teeth, you don't have to worry about there being plaque or anything like that, no abscesses, they're just clean. Another good reason to make sure you floss and brush your teeth is you will have pink gums that don't bleed, which is always nice when you go to the dentist and you hear about somebody saying that they got their gums cleaned and they started bleeding. So by brushing and flossing your teeth, you don't have to worry about things like that. So some tips on brushing and flossing. One of them is to actually hold your toothbrush at a 45-degree angle and make sure that you go front to back on the outside, the inside, and on top, but make sure specifically on the inside you're brushing up and down instead of side to side. Another thing is to make sure you always brush your tongue, because you want to remove the bacteria that sits on your tongue. And sometimes the bacteria, if you don't brush your tongue, can actually transfer over onto your teeth. Some tips about flossing is to always make sure you curve the floss into a C shape around each and every tooth. Unless you have a crown or a cap on your tooth, then you always want to make sure that you're pulling out. Make sure that you are going up and down and not side to side, because some people think that going side to side is just sufficient, but really it's not. You're not really scraping anything off. And then mouthwash is also always a good thing to have. You don't have to use it, but it's a good additive to make sure that you feel fresh, that it's like almost like a protective layer on top of brushing and flossing your teeth. And these are my references. And that is all. Thank you.